Anatomy and Physiology Tutorials, Skeletal and Muscle ID. We will begin with a look at the skeletal system. Structure of a long bone. The end of a long bone closest to the body's trunk is the proximal epiphysis. The end further from the trunk is known as the distal epiphysis. The shaft of the long bone is the diaphysis. The majority of the bone found in the epiphyses is spongy bone. This is where red bone marrow is located. Red bone marrow functions in blood cell production. Along the diaphysis, we find mostly compact bone. Carved out of the diaphysis is a hollowed out area known as the medullary cavity. This is where yellow bone marrow, which is adipose tissue, is stored. On the ends of the long bone, we find articular cartilage, which acts as a pad between bones and reduces friction and also absorbs shock at freely movable joints. A line of cartilage at the junction between the epiphysis and the diaphysis is the epiphyseal plate, which is where bone growth occurs. As an individual ages, the epiphyseal plate ossifies and lengthening of the bone ceases. Periosteum forms a membrane on the outer surface of bone everywhere except where articular cartilage is found. Let's take a look at a wedge of bone magnified, showing the spongy and compact bone. Spongy bone is made up of a network of open spaces. The structural units are called trabeculae. It reduces the weight of bone but is still very strong. Compact bone is hard and dense. It is made up of cylindrical structural units known as osteons. Ligaments are composed of fibrous connective tissue that attaches bone to bone. Ligaments function in stabilizing bones in a joint. Our skeletal bones are classified as either axial, seen here in blue, or appendicular, here in beige. We will begin with the axial bones. Bones making up the skull, thoracic cage, and vertebral column will be identified. Cranial bones are bones of the skull. These are the parietal, frontal, occipital, and temporal. Facial bones are bones of the skull as well. These are the nasal, zygomatic, maxilla, and mandible. The paranasal sinuses are spaces or cavities with some of the cranial and facial bones. They are the sphenoid, frontal, ethmoid, and maxillary sinuses. All drain into the nasal cavity. The vertebral column is composed of 7 cervical vertebrae, 12 thoracic, and 5 lumbar. On the distal end is found 5 fused vertebrae, the sacrum, and 4 fused into the coccyx. The thoracic cage is composed of the sternum, commonly referred to as the breastbone. Attached by way of cartilage are the 7 true ribs. Ribs 8 through 12 are known as false ribs because they do not directly attach to the sternum. Ribs 8 through 10 indirectly attach by way of cartilage, whereas ribs 11 and 12 are the floating ribs. They do not attach to the sternum at all. We now move into the appendicular skeletal. The pelvic girdle is composed of 2 coxal bones, or referred to as your hip bones. The pectoral girdle is composed of the clavicle and scapula. The upper arm bone is the humerus And the two lower arm bones are the radius, which lines up with your thumb, and the ulna, which aligns with your pinky finger. Those appendicular bones making up the hand are the carpals in the wrist, metacarpals in the palm, and the phalanges, the fingers. Bones making up the leg are the femur, patella, tibia, and fibula. Sometimes the tibia and fibula are confused. Remember, the fibula lies on the lateral side of the leg. Fibula, lateral. Bones in the foot are the phalanges in the toes, metatarsals, and tarsals. Types of joint movements. In order to move your skeletal system, muscles must pull on bones. Let's take a look at some of the movements. Flexion decreases the angle of the joint, and extension increases the angle of the joint, as seen here in the elbow and the knee. Abduction moves a bone away from the midline, and adduction moves a bone closer to the midline of the body. Dorsiflexion is the bending of the foot so the toes point upward, and plantar flexion is the bending of the foot so the toes point downward. We now move into muscles, which will work to move or pull on our bones. Skeletal muscle anatomy. Myofilaments are made up of the thin filament actin and the thick filament myosin. Bundles of myofilaments make up a myofibril. Bundles of myofibrils make up a muscle fiber. Bundles of muscle fibers make up a fascicle, and bundles of fascicles make up the muscle. Muscles are attached to the bone by way of tendons. The unit of muscle contraction is known as the sarcomere, found lined up one behind another along a myofilament. Identifying facial muscles. Sternocleidomastoid. Contract one, moves the head from side to side, contract both, flexes the head. Orbicularis oculi, muscle around the eye that closes the eye for blinking. Orbicularis oris, muscle around the mouth that puckers the lips. Pectoralis major, chest muscle, adducts the humerus across the chest. Trapezius, moves the shoulder, shrugs or elevates and rotates. Deltoid, abducts the arm. Biceps brachii, flexes the arm, decreases the angle of the joint at the elbow. And triceps brachii, extends the arm, increasing the angle of the joint at the elbow. External oblique, compresses the abdominal cavity. Rectus abdominis, stomach muscle that flexes the vertebral column. Latissimus dorsi, adducts the humerus across the back. Gluteus maximus hyperextends the leg. Rectus femoris extends the leg. Biceps femoris flexes the leg. Gastrocnemius, plantar flexes the foot. And here the calcaneal tendon connects the gastrocnemius to the heel bone. This concludes the tutorial on the skeletal and muscular systems.